Hi, this is Governor John Carney. I want to take this opportunity to welcome you to the Igniting Innovation Week, hosted by the Delaware Bioscience Association. Although the annual celebration is virtual this year, it's important for us to celebrate the strength of the bioscience community here in Delaware. We know that researchers and organizations in our state have been working hard over the past several months to help combat COVID-19 and other serious health challenges. Whether it's developing a vaccine and treatments for COVID-19 or strengthening our supply chain through research and new technologies, your efforts are making a real difference.
Hi, Lieutenant Governor Bethany Hall-Long. I want to thank the Delaware Bioscience Association for going virtual with Igniting Your Innovation Week. As a neuroscientist and research scientist myself, I really want to thank you for what you do in leading the way here in Delaware. Your collaborative efforts with over 7,000 employees that are represented who are doing the hard work during these difficult times, particularly during COVID. This really shines a light on the role that the Delaware Bioscience Association plays. For example, we know some of our partners are playing a key role as we search for a vaccination and other treatment modalities. I just want to say thank you so much for the work that each and every one of you does. And as we do this Innovation Week, let's really celebrate and stay safe and stay well.
Hi there, I'm United States Senator Tom Carper of Delaware. And I just want to say to everyone who's a part of the Delaware Bioscience Association, thank you for all you do. Thank you for your contributions and to our state and to our country. For those of us who served in the military, one of the things we used to say in the Navy when people do a especially good job, we would say the words bravo Zulu. And I think that certainly applies here. It means good job, great job. And I'd also say bravo Zulu, but I'd say keep it up. As we need you, I'm counting on you. Thank you. God bless.
Hi, I'm U.S. Senator Chris Coons. To all the frontline healthcare workers helping people to recover, managing testing sites, or working tirelessly to develop a vaccine and find a cure, thank you for choosing to help, heal, and prevent. Science matters, you matter, and I am grateful for the Delaware bioscience community and all you do.
Our fight isn't over. We have to take the right precautions to protect ourselves, our employees, our families, and our neighbors. Staying vigilant will help us keep the progress we have already made. We'll get through this by working together and doing our part to keep each other safe. As I've said over the course of this pandemic, you can't have a healthy economy without a healthy community, and Delaware's bioscience community is helping us achieve both. Thank you for the great work that you do day in and day out, supporting Delawareans and making advances that improve the lives of your neighbors.
Greetings and welcome everyone to Day 2 of Delaware Bio's Igniting Innovation Week. I'm Michael Fleming, President of Delaware Bio. We got this week off to a flying start yesterday with a terrific interview with AstraZeneca's Ruud Dobber, a fascinating discussion with our board member Philip Amoa. That interview is now available on our website, delawarebio.org, as will each day's content throughout the week. So you and your colleagues will be able to view all of our presentations at your convenience. Today, we focus on Delaware bioinnovation that is improving the lives of children here in our state and well beyond our border. There's nothing more important than caring for the most vulnerable, our children. And every day in Delaware, we have member organizations focused on doing just that. Today, we'll learn about cutting-edge research and the application of technology that's bringing hope and joy to the youngest among us in need, while cementing Delaware's status as a global leader in children's medical care. Before turning to these compelling stories, I want to thank all our sponsors for making this week-long celebration of the Delaware bioscience community possible. In particular, special thanks to today's sponsors, Nemours Alfred I. DuPont Hospital for Children and Agilent, for their generous support and partnership.
This video celebrates those researchers who make a difference in the lives and health of children. We'll begin at Nemours Children's Hospital, and I'm sure many of you in the audience who have children, especially those who play sports, have been to the great emergency room more than once. You may also know that it's a world-class pediatric hospital and it has a Class 1 trauma center. You may also have utilized their online Care Connect portal for telemedicine. but I'm quite sure you're not familiar with all the research that's going on there. So let's now turn to Dr. Judy Ross, who will tell us more.
Our goals here at Nemours are not only to provide the best possible care and increase the research and outcomes for children, but to build capacity and to train current clinical researchers and the next generation of researchers. Nemours DuPont Hospital for Children has 620 ongoing basic and clinical research projects, 128 principal investigators and lab heads, and about a $45 million a year research budget. We have focused on 4 main areas that are high impact, and those include airway disease and cystic fibrosis, cancer outcomes, markers and therapeutics, neurodevelopment and musculoskeletal disease, and diabetes and obesity. There is a unique interaction between the researchers and the clinicians. It's bench to bedside and then back into the community. So we are uniquely poised in the state of Delaware to be able to address these fundamental problems that affect pediatrics.
I think that speech is one of our most human and unique capabilities. We're developing personal synthetic voices for children who are either non-vocal or not able to speak. Doing that using a speech technology that lets us record amounts of speech from a fluent, typically developing child, and we then use those recordings of speech from that child to train a machine learning algorithm that's based around a speech synthesizer to produce synthetic speech that sounds like the recordings that we obtained from the fluent speaker. One of the things that we're doing right now, and we have a small NSF grant to approach this, is looking for ways that we can do a better job of modeling the intonation and timing of speech to make it more expressive. I think expressiveness is the major shortcoming in most synthetic voices today. Giving them a personal voice that sounds like no one else just helps to maybe shed away some of that technology that they're surrounded with and make it easier to see the person in there.
The NCORE is the NCI Community Oncology Research Program. This is a federally funded program to bring state-of-the-art clinical trials to patients in their community. When we started our journey in the NCORE world 6 years ago, we were ranked in the nationally in about the 25th percentile in terms of enrollment on clinical trials. This past year, we were ranked in the 94th percentile. I think the NCORE established Nemours as a leader in clinical cancer research in the country, and with that we have access to other opportunities. So we'll be delivering cellular therapies. We have access to some very innovative immunotherapy trials for kids with cancer. We've been selected as one of the lead sites for the Leukemia Lymphoma Society Pediatric Acute Leukemia Initiative. This will be probably about $100 million 5-year investment, and it will essentially be a master trial for kids with leukemia. So we'll have sequencing data available on all these kids. We'll have comprehensive immunoflow cytometry on all these patients, so we know the immunotherapy targets that these kids express. And then we'll have a master protocol that will make sure that kids get the right therapy based on the targets that they express. This is a tremendous investment by the Leukemia Lymphoma Society. They've never done anything like this in pediatrics before. And to be one of the lead institutions is a huge honor, and I think is a great benefit to our patients here in the Delaware Valley.
We move on now to the University of Delaware, where we will learn about 3 research programs improving connections, independence, and life outcomes for children. We begin in the lab of Dr. Mary Dosher, who recently received a Lifetime Achievement Award from the American Psychological Association.
One night I saw a child being taken away from her foster parent on the news. The child was screaming, and I had a young child myself, and I thought it would be no different than if you took my child away from me. And I started, within a couple of weeks of that, deciding that I wanted to do that work and started to ask questions about how children form new attachments to their foster parents, and also then starting to think about how do you help foster parents behave in ways that are going to help enhance children's outcomes. Children need to develop a trusting relationship with their parent. They need a parent who can interact with them in ways that are very responsive. You build a solid foundation, and then the child's much better able to handle challenges as life goes along. The example is a mom who is living in a motel room. Her 8-month-old is just not thriving. She is not really engaged with her world. And then what you see during and following the intervention is that you see this child transformed. You see this child engaged with the world, you see her engaged with her mom, you see this mom responsive. But the child's world has fundamentally changed because the mom has changed. And over the last 25 years, we've been developing this parenting program. And what we do is we have tested that to see whether it's effective in terms of enhancing children's brain and behavioral outcomes over time. I never dreamed that the effects would last beyond right after the intervention. And the effects are just as big 3 years after the intervention as they are immediately after the intervention. And then we still see those effects when children are 9 years old. Even though it's a 10-session intervention, things are changing such that children continue to see the positive effects of this over time. I think one of the things that happens, though, is parents change and they stay changed. So that's really what we're talking about here, is supporting parents who can then support children building this foundation.
Mobility is a human right, and at Go Baby Go, our sole mission is to help individuals worldwide co-create their world through mobility. We're most known for the age group between kind of birth and 3 or 4 years old, and those are with the cars you see. Those are the modified toy cars. In this building, we built the very first car. And from that car to the now 9,000 cars worldwide, it's spread based on individuals stepping up and going, I'd like to build a car for a kid. We realized fairly quickly that building a car for a kid could benefit much more than just the driver. When you get 6th graders building as part of STEM classrooms, you actually reorganize science classrooms around the country. That led us to do a curriculum specifically for middle schoolers that is already being used in 70 districts just from word of mouth. Right now, kids all over the world are sitting unnecessarily while friends are playing. And when we find you, you get a car. And when you get a car, you will leave the building. And that freedom and independence will change your life and change the community's life.
My background's in fashion design, and then my PhD is in biomechanics, and that's an unusual combination. We can intersect fashion and biomechanics in a way that helps kids improve healthcare outcomes because we can create devices that are kid-friendly. If you're thinking about creating something that improves functionality, for example, or improving mobility or improving independence, fashion allows you to do it in a way that's user-friendly, that's comfortable, that maybe looks cool, that maybe the kids are excited to wear this device or that device because they feel like, hey, this feels like me and I'm expressing who I am. We created this line of denim that has hidden features that are pretty cool. So at the bottom here, we've got a magnet closure. They also have magnets here in the fly, but that it looks like a typical fly, but instead it's much easier for either the caregiver or for the child to open and close them. And so this allows the child to be much more independent, but they're also cute at the same time. We have the technology to embed materials into the fabric. We have the technology to body scan individuals so we get that custom fit. I used to be a caregiver to someone who had chronic illness, and so I understand and I empathize with those families, and helping them, seeing something actually work and be successful and impact that child or that adult's life, that really inspires me. I think the more that we can individualize medicine and really be empathetic to that end user, I think that's what's thrilling to me, and I feel like that's where we're headed.
What inspiring stories. Our thanks to the researchers who devote their lives to addressing the devastating conditions that bring far too much pain and suffering to children and their families. Thank you again to our sponsors, Nemours AI DuPont Hospital for Children and Agilent, for making it possible for us to share these great stories of our Delaware colleagues truly making a difference in the lives of children. That's it for today's edition of Igniting Innovation Week. We look forward to seeing you tomorrow morning at 9 a.m., where we'll be focusing on some of the most exciting new products and services the Delaware bioscience community has delivered over the last year.